Okay, hi guys. Thank you for coming and tuning in to this week's Craniofacial Clinical Pearl. And what I'm going to talk about today is how to reduce tone and tightness. And so think of any joint. You have pain. Pain causes muscles to tighten up and to go into a state of guarding, right? So what we want to do is kind of break that cycle of high tension. So one good way to do that is with the essentially an isometric. Very simple. So what I want you to do, Alex, just open your mouth, separate your teeth a little bit, bring them in a little bit. Okay. So this is a simple isometric. Again, you're going to have your hand placement at the mandible, okay, right and left side. I usually use my 2-finger pads, index and middle finger. And what I say is, okay, I want you to match my resistance. So, yep. Okay, so relax. That is good, Alex. I want you to do it. Don't do it too aggressively, okay? So just match. Yeah. All right, and relax. And then I might do the other side. Yeah, match and relax. And again. Good. Okay, so one thing with the isometric, you know, as you contract intentionally, you know, your brain is telling your muscle to contract. And then when you relax, it will relax instead of staying on all the time. Another good thing for it too, guys, is that, you know, you notice how I said don't go so hard. So you want to do it at different pressures to kind of work some control of the muscle, because it is true. Sometimes you're working with someone with a lot of tone in their jaw, and they just, everything is 10 out of 10. So I would recommend that you try different, you know, different pressures, you know, a little bit of pressure, moderate pressure, and then you can go stronger pressure. But just be careful not to go strong if they got some acute, pretty tenderness there. So, all right, let's try it again, Alex. And I have them separate their teeth just slightly. Apply some, match my resistance. And so, match my resistance. Good. Now you can do some different angles here. You can do kind of a, you know, a little bit of a lateral angle, right? Good. And you can even have them, you know, I want you to open a little bit. And then I can kind of take my thumb and hook here and just, yeah, exactly, okay? All right, so very simple, but it's a good way to do two things. One is to reduce tone, and secondly is to improve motor control, okay? So this is a quick tip this week. This works very good. Most all patients, whether you have a patient that's hypomobile and they have a lot of clicking and they have poor control, this is a good way to gain some control. Or a patient that just has, you know, a lot of tightness, they might have trismus, they might have, you know, just a lot of achiness. This is a good one. So I do use this one pretty much on all of my craniofacial patients. Well, thank you guys for tuning in, and we'll see you next time.